Radiofrequency catheter ablation is a procedure that we perform for a variety of cardiac rhythm problems. The procedure has been around for years. It has been expanded and used for supraventricular tachycardia, atrial flutter, ventricular tachycardia, and atrial fibrillation. Today we're going to talk about radiofrequency catheter ablation for atrial fibrillation. In this procedure, catheters are advanced through the veins of the leg into the heart. The areas that are functioning abnormally are then targeted. Radiofrequency energy is applied. This heats the tissue, rendering that abnormally functioning tissue inactive. In a wide variety of rhythms, it can actually cure the rhythm problem or certainly manage it and treat it successfully. The procedure itself is minimally invasive. Catheters are advanced through veins in the groin. The patient's asleep during the procedure, so there's no discomfort during the procedure. It is a lengthy procedure, and depending on exactly what we find during it, the procedure may go anywhere from an hour and a half in length up to 5 or 6 hours. After the procedure, there may be some mild discomfort at the places where we put the catheter in the groin and some mild chest discomfort for a few days. Catheter ablation has been around since the late 80s and early 90s. It expanded for use in atrial fibrillation in the late 90s. In fact, the first catheter that was approved for use for the treatment of atrial fibrillation was approved in 2005, and the Heart Hospital Baylor Plano was involved in that research study. Since then, we've been involved in several other research studies, pushing the technology and advancing it to the state where it is today. When a patient undergoes a successful radiofrequency catheter ablation for atrial fibrillation, he will no longer require medicines to control his rhythm problem. Now, depending on the patient, they may still have to stay on blood thinners as their risk of stroke is still present. Remember that one of the main problems with atrial fibrillation is an increased risk of stroke. So managing the rhythm helps, but may not be sufficient. After the procedure, there will be a few days of recovery, but within a week or two, most patients are back up to their usual activity levels. Catheter ablation has been around for years, and we've done thousands of them here at the Heart Hospital. For this reason, I think you can trust our staff and our physicians to do a good job for you.